So after our last video, some questions began to come in concerning how one can properly distinguish between diabetes mellitus and diabetes insipidus. But one of them rightly stood out very clearly. Look at this. If diabetes insipidus doesn't have anything to do with excess sugar in the body, why then is it called diabetes? First of all, I think this kind of question comes from the fact that majority of what people know about diabetes has to do with excess sugar. And just like I promised in the last video, we are going to answer these questions by looking at what diabetes insipidus really is, and then again explore the differences between these two conditions. So I need your attention to this video, and if you haven't subscribed to our channel, please ensure you do that right away. Now, diabetes insipidus is a medical condition that occurs when the body is not able to properly regulate water balance through a hormone called vasopressin. You can also call it anti-diuretic hormone. You don't need to bother about the differences in all these names, but you need to understand that all of them are referring to the same hormone, and this same hormone is produced by your brain. So this hormone vasopressin helps the kidney to conserve water by limiting the amount that is lost as urine. So the whole problem about diabetes insipidus starts when the vasopressin becomes absent, insufficiently produced, or the kidneys are resistant to its action, thereby making excess amount of water to be lost as urine. And this is where it becomes very interesting, because currently there are a lot of confusion concerning these two conditions. And part of this confusion comes from the fact that two of them share the same name, diabetes, which is a Greek word for to pass through. Now, in this case, it implies to pass through excess urine, which is a common symptom in both of them. And just like the law of cause and effect, there will be a consequent increase in demand for water to make up for these ones lost as urine. And so basically what we're saying is that there's a shared symptom, there's a similar symptom of increased urination, and there's increased thirst as you need more water to make up for the ones you've lost. Apart from all these few similar symptoms they share together, there seem to be more differences in them than we could ever imagine. For instance, the amount of sugar contained in those urine produced in all of them differ. And this is probably the biggest differences you're going to get in all of them. If diabetes mellitus is not properly managed, excess sugar begins to spill into the urine, thereby drawing more water from the circulation because sugar is already excess in the blood, then making excess urine to be produced. So what we're saying is that the urine produced in diabetes mellitus will contain more sugar, giving it that name mellitus, which is a Latin word for sweet as honey. On the contrary, the urine produced in diabetes insipidus does not contain excess sugar as so, and that's if it contains any sugar at all. Instead, it contains a very dilute urine which has little or no amount of sugar in them because the kidney is not able to concentrate it as in the other case, giving it that tasteless feeling. And that's where the name insipidus comes from. It's a Latin word for tasteless. Looking at it from afar, you may be tempted to assume that all of them have the same hormonal issues, but that's not how it is exactly. The primary hormone that is involved in diabetes mellitus is insulin, and in our last video, we mentioned that insulin helps to move sugar from the bloodstream, from the circulation in the bloodstream to the cells where they are being used. And so the problem of all this diabetes mellitus starts when this insulin becomes insufficient, absent, or the cells are resistant to its action, thereby making sugar to accumulate. But on the other hand, the primary hormone responsible for regulation of water balance in diabetes insipidus is vasopressin, or what you call anti-diuretic hormone. Remember I told you it's just the same name. This one helps the kidney to conserve water to limit the amount of water that is lost as urine. But unlike the case of diabetes mellitus, the problem may start when this hormone becomes absent, insufficiently produced, or the kidneys are resistant to its action. So basically what we are saying is that while diabetes mellitus is an insulin problem, diabetes insipidus is a vasopressin problem. By the way, you need to understand that having a good knowledge about your health is the biggest and greatest you can ever have. And if I were you, I wouldn't let this kind of channel pass me by without subscribing. I won't even stop there. I will make sure I turn on my notification button so that each time a video comes, I will not miss it. Just think about it. Now, if you look at the causes of all these two disease conditions, you will discover that they have more differences than you would ever imagine. Look at it this way. The primary causes of diabetes mellitus have been listed to include poor dieting, poor stress management, old age, genetic factors, and autoimmune disease. Whereas in the case of diabetes insipidus, you have cases like damage or injury to the part of the brain that produces vasopressin. You also have genetic factors, and there is also resistance to the actions of the vasopressin. So you notice something very interesting here, that in both cases you will see genetic factors. But don't let that deceive you, because the genes involved in each of them are totally different, and the organs they act on are totally different as well. So, but this is not all the differences we have here. There are more symptomatic differences too. For instance, in the case of diabetes mellitus, you see that you have excessive hunger, unlike the diabetes insipidus. It did not stop there. There are still some other symptoms like blurred vision, nerve damages, excessive weakness, things like slowed wound healing. All these things are found in diabetes mellitus, which are not exactly like that in diabetes insipidus. So having a good understanding of all these things will help to clear away all the confusions that surround these two medical conditions. But then one would ask, can these two conditions exist together in one person? Yes, it's possible to happen, even though it's very rare. But sometimes it can happen, making diagnosis very difficult, more difficult than you ever expected. And that's why healthcare professionals need to take out their time to carry out all the necessary tests that are required to establish diagnosis in each case. For diabetes insipidus, healthcare professionals are supposed to carry out what is called water deprivation test. It will interest you to know that we've made a video detailing all the tests you need to establish diagnosis in diabetes mellitus. So in case you've missed it, just check out this and you go to watch it. So what we're saying is that even though these two conditions share some few similar symptoms, they have more differences, and understanding this will help you to properly differentiate them. And not just differentiating them, it will help you to clear all the confusions surrounding them, help you to get accurate diagnosis, and also help you to get accurate medical attention in terms of treatment. So if you have any question regarding all we have said, please feel free to drop it at the comment section, and if you have any contributions to make, that's also welcome. Don't forget to share and subscribe to our channel. Thank you so much for watching. We hope to see you again in our next video.